Hi everyone, good morning. This is Dr. Ben Behnam, and welcome to another AMA session with Dr. Ben. I'm the founder, I'm one of the co-founders, and also the chief medical officer of Happy. So welcome. I know we're starting a few minutes early today, but thank you so much for joining me. Today, actually, I'm currently in my own local office down in Los Angeles, California, and most of the team is working remote today. So we're going to start off with some of the questions. Usually we talk about a topic every week. This week's topic is going to be basically foods or basically healthy habits that's going to help your hair. When most patients come to my office, one of the first questions I ask is that whether if they're vegetarian or not. Being vegetarian unfortunately does impact your hair because you are not taking in the nutrients and amino acids and vitamins basically that you may need. So, when typically patients come in, one of the first questions we ask them is that if they're taking the appropriate vitamins. We sometimes do check their labs, but honestly, I think everyone should be taking a regular multivitamin along with a vitamin D3, about 2,000 IUs a day. If you're female, you should be taking additional iron. And my recommendation for iron, I like the 18 milligram liquid iron from Whole Foods because that's not very constipating. But also, again, it really depends on your iron level. If your iron level is very low, your hair will definitely not grow, and you may need to supplement with more additional iron. So I highly recommend that you go in and see your doctor and basically have your labs checked. Also, collagen is very important. We like the brand Vital Proteins. Again, I'm not affiliated with them, I'm not associated with them. They're a good brand. Just it's a collagen powder, one scoop, added to your milk, smoothie, whatever you want, to have it every day. And more importantly, also, please do not do any creatine. No creatine. That's very important. And also, if you are working out, please do not do any whey protein isolates. So no isolates. If you do want to work out, you could either use like a vegan protein or pea protein or do a whey protein concentrate. So there are two types of whey proteins: isolates and concentrate. Isolate will cause more hair loss by increasing testosterone level. Concentrate basically is better for you. Also, try to minimize energy drinks, processed foods. So those are all very important as well. All right, guys, now we're going to start with our questions. Thank you so much for all the questions that are coming in. So, any negative side effects are high levels of finasteride or minoxidil. So, one of the reasons why we actually made Happy It was because oral finasteride has a risk of sexual side effects. The side effects happen about 2 to 4% of patients, and so this is why we formulated topical version because the topical has a lower risk of sexual side effects according to clinical studies. Other side effects of finasteride include anxiety and depression, but extremely rare. With respect to minoxidil applied topically at high concentrations will cause more irritation. So you could get irritation and inflammation of the scalp. That's one of the major side effects that we typically see. Other side effects of minoxidil includes changing blood pressure, feeling dizzy, lightheaded, heart palpitations. So those are the most common things. Thanks so much for asking that question. Also, the thing is that most people do not know if they're going to have side effects or not unless they try the product. So if there are any problems with the product, please let us know. Send us a feedback to help@happyhead.com, and we will be more than happy to reform the product for you and send it back. So, for example, if you are using the minoxidil 8% and it's causing irritation, let us know, and we'll be more than happy to either reduce the minoxidil concentration or even take it out completely, or maybe remove the retinoic acid from the product. So, everyone's different. You just have to let us know what's going on with the product. Is the retinoic acid or the 8% minoxidil that's causing the scalp sensitivity? Will the scalp become used to it as I use it? So yes, it is a retinoic acid along with the minoxidil 8% that causes the slight irritation on the scalp and the scalp sensitivity. Some people get used to it, some people don't. If it's causing too much irritation, let us know and we'll remove the retinoic acid, or will basically reduce the concentration of the minoxidil for you. So please just let us know. We'll be more than happy to change the formula for you and send you a new bottle. Remember, this is a customizable formula. This is what makes Happy Head unique out of all of our competitors. We could customize it for you and ship you out a new bottle, and we are here to help you out as much as we can. So please let us know. Thanks so much for that question. Do you think oral minoxidil works as good as topical? I mean, yeah, I think it does. I think the topical works pretty well. I have some patients in my clinic that actually do oral and topical minoxidil. So if you're using topical minoxidil for a while, you could actually start taking the oral minoxidil as well. And look, oral minoxidil does work as well. There's nothing wrong with the oral. And if you do want to get on the oral for better results, you could always basically get on Happy Head. And Happy Head, we also sell the oral minoxidil as well. Does Happy Head cause body hair growth? Typically not. I mean, the oral minoxidil causes body hair growth, but the topical minoxidil of Happy Head, it does not. I mean, unless you're putting it to the rest of the body. So the answer is no. Does Happy have any measurable effects on hormones like testosterone and estrogen? Very good question. So first of all, if you really want to figure it out, and remember, everyone's different, so results varies. So if you really want to figure it out, you could do a blood test before as well as after using the product, and you could measure your testosterone level and estrogen level. In clinical studies, topical finasteride did not affect the total testosterone level in the body in pharmacokinetic studies. But remember, everyone's different. So thank you very much for asking that question. Would Happy theoretically increase eyebrow growth if applied daily? Well, if you apply to eyebrow, yes, but we do not recommend using the current formulation of Happy to the eyebrows. The reason is because there's hydrocortisone in it, and we don't want to do that. So we are coming out with our own eyebrow version. It should be out soon. And if you're looking for that, please let us know and we'll send you the correct link. But yes, we have shown that basically Happy to apply to eyebrows does work, but do not use the current version because it has hydrocortisone in it. You have to use one that does not have hydrocortisone in it. If you have high blood pressure, will Happy and increase it further? It should not increase it further. Minoxidil, either topically or oral minoxidil, is used for patients with high blood pressure. So if you have high blood pressure and take an oral minoxidil prescription, it will reduce your high blood pressure. So it is not going to give you high blood pressure. What is the supercharged version that I can use? So we have a version that combines topical finasteride with topical dutasteride. Is what we call this the kitchen sink formula. And you could basically request that. Just email Happy and basically they'll send it to you. So it's basically what it is that. So finasteride inhibits one enzyme that's responsible for converting testosterone to DHT. Dutasteride inhibits two enzymes that basically that converts testosterone to DHT, and we combined the two together to give people the boost. So if you really want the supercharged version, please basically just email Happy and then they will send you the link. I have a scar tissue from prior transplant. Can I use the roller over the scar tissue and apply Happy solution? Will that bring back hair? So if you have a scar from the hair transplant, there's no hair in there. So so I don't think it's gonna help you much to bring hair through that scar. But generally, yes, you could use a derma roller on your scalp if you have a scar or not, and you could use the Happy Head on top of it. Yeah, those are they should all work. But if you have like a strip scar from a previous transplant, it is not going to work. Unfortunately, what could be done is that basically we cut out the scar and basically restitch it up. So it's called scar revision, and Dr. Sean in our office basically does that. But Happy Head is not going to help you. Now, if you're thinning anywhere else on the scalp, you could use Happy Head. That's not a problem. Are bags under one's eyes a side effect of minoxidil? If so, is there a way to reduce the effect? For example, using in the morning versus at night, using it once a day. Does this get better over time? Yes. So minoxidil, one of the side effects of minoxidil is swelling. So people could swell from them underneath the eyes. Some people could get lymph node enlargement, and when you take oral, you could get swelling of your legs. So yeah, so it's the swelling on the eyes that could happen. So what we could do for you is to either reduce it or remove the minoxidil completely. Typically, it does not get better over time, so I think we kind of have to do something proactive about it. So why don't you email support and say, Dr. Behnam said, let's reduce the concentration. Let's start with that. If that doesn't help, then we could remove the minoxidil from your product. Again, Happy is a customizable product made for our patients. So if there's any issues, we'll be more than happy to customize it for you and send it to you. Thank you so much for that question. Is topical retinol effective at growing hair and treating baldness by itself or only with minoxidil? So alone by itself doesn't really help that much. The whole point of retinol or retinoic acid in these products is that it kind of irritates the skin and stimulates the collagen and irritates the skin. As a result, opens the pores and allows better penetration of other ingredients into the scalp. So by itself it doesn't work, but in conjunction with other ones it works. um so um so my recommendation is that have the retin-A be in the mix, unless if it's really bothering you, then we could take it out. So if you're experiencing like too much irritation, then we could take it out. Does finasteride raise progesterone? Typically not. Obviously, I'm bet true to some patient that it does it, but typically it does not. Does the pen or the manual version of Derma Roller work better? I actually like the pen, the automatic pen. I think it works better. There is a brand called Dr. Pen out there, and we do like it quite a bit. And also, I think it's less chance of it hurting you, and also a better chance of being systematic. So yeah, I would recommend Dr. Pen. Put on the 0.25, and when you apply the topical happy at night, you could basically just Dr. Pen it, and that's going to penetrate the product more in there. Guys, these are great questions. Thank you so much for all these questions today. We really appreciate it. Can finasteride regrow hair follicles? So here's the thing. So typically what happens with hair follicles is that miniaturizes, which means basically getting smaller and smaller. And one of the reasons why that happens is because testosterone gets converted to DHT. DHT binds to hair follicles and shrinks the hair follicles. So what finasteride does is that it inhibits the enzyme that converts testosterone to DHT. So by blocking that enzyme, as a result, your DHT, you don't have DHT to bind to the hair follicles to miniaturize it. So in essence, what finasteride does, it inhibits the miniaturization, and as a result, it basically allows the hair to regrow back and thicker. So when we look under our basic magnifier, when patients have been using Happy for a while, and we look under magnifier, we see that they have thicker hair, they have thicker hair follicles. So the question is, regrowing? So are you growing out new follicles, or are you thickening the caliber of those current follicles? The answer is that you're thickening the caliber of those current follicles. If you don't have a hair follicles, there is not going to grow back. So that's why when patients are bald, using Happy Head is really not going to help you. Happy Head only works when you have kind of like peach fuzz hair. It's going to when you have thinning. So then it's going to thicken up basically those hair follicles. If one is taking oral dutasteride, what is the best does? I don't understand that question. So if you're taking oral dutasteride, I guess what is the next best option? So oral dutasteride is very similar basically to, guys, sorry, I'm having a bad hair today. So if you're taking oral dutasteride, it's very similar to taking oral finasteride. The only benefit is that with oral dutasteride is that you're inhibiting two enzymes as opposed to one. So in theory, it's supposed to work better. And the question that basically that is typically asked is that, so what is the best dosage for the oral dutasteride? So it's just basically one tablet a day, which is 0.5 milligram. So just one tablet a day. We don't go above the one tablet a day. Now, there are some patients that do oral dutasteride, and if they don't see any improvements, you could obviously add, the topical Happy onto it to get better results. And in fact, we're going to show a patient in the next few weeks. We saw a patient last week who was using oral finasteride for a while, and he was just not seeing the improvement. And then we added topical happy and topical finasteride to the regimen, and literally so much hair grew out. And the reasons was because he was taking oral finasteride and it was just not getting enough to his scalp, or had become used to it. So by adding the topical version of it, it's basically just literally applying it where you need it. So it's just resealing those hair follicles, and it got really good growth. Does finasteride help alopecia? So alopecia is a generic name for hair loss. So male pattern thinning is known as androgenetic alopecia. So finasteride does help with androgenetic alopecia. The question is, what are the other types of alopecia? So for example, alopecia areata, where basically you have a bald patch and the hair is not growing out. So finasteride hasn't really been shown to help alopecia areata. Reason being is because the etiology, the reason of alopecia areata basically is just different. So etiology is different. So it doesn't help alopecia areata. The alopecia areata is due to like a lot of inflammation surrounding the hair follicles. So the best thing that's going to help alopecia areata is like a cortisone shot. So thank you so much for asking that question. There are also other type of alopecias, for example, cicatricial alopecia, which is scarring hair loss, and finasteride does not help with that one either. What does finasteride do? Is only finasteride enough? So finasteride inhibits testosterone from converting into DHT, dihydrotestosterone. Um, and as a result, when you don't have DHT, you prevent the miniaturization of hair follicles. In other words, if a lot of DHT is present in your scalp, DHT binds to your hair follicles and makes your hairs smaller, thinner, what we call miniaturization. And that's what seems to be that's what's called thinning. So that's what finasteride does. It blocks that enzyme, reducing your DHT level on your scalp. As a result, basically your hair grows back. Now, is finasteride enough? Yeah. So sometimes it is and sometimes it's not. I mean, everyone's different. In our formula, we try to provide a cocktail, which means we want to attack uh, the hair thinning problem from many different aspects. So finasteride inhibits the testosterone, but we also have minoxidil in there that vasodilates the blood vessels and increases blood flow. And we have retinoic acid that basically enhances the effect of minoxidil. So we have three ingredients all trying basically with the aim of trying to regrow the hair. So yes, is finasteride it's good enough? Yeah, it's good enough, but there are better options. And Happy It has the better option because we have a 3-in-1 formula. I've applied Happy It after shower and I felt it sting in my scalp. Should I not apply after shower? Yes. So the problem with shower is that when people shower and be using shampoos, sometimes the alcohol from the shampoos irritates your scalp. So when you apply Happy It directly right afterwards, it could sting a little bit. It doesn't really mean anything. This thing usually lasts about 2 to 3 minutes and then it goes down. So I mean, you can continue to use it as long as you can tolerate it. If you can't tolerate it, just you know wait a while after shower and apply it, or just do it in the morning. How long does one need to leave the minoxidil on the scalp before showering? Also, can one dry one's hair shortly after putting the solution with minoxidil on the scalp? Good question. So technically, we tell our patients to apply Happy Dye to the scalp and just basically leave it on. However, there's some patients that get irritated from the minoxidil, so you're allowed to wash it off after 1 hour, and you're still gonna have very good efficacy. Can you dry your hair after? Yeah. I mean, look, just the Happy End dries up pretty quickly, actually. So after a couple minutes, you could dry your hair and it shouldn't be a problem. Does using the roller over scar area and using Happy End regrow hair in that area? Yes and no. I mean, it depends what the scar is. So, for example, so for example, if you have the scar basically from a prior hair transplant. Yeah, so if you have a scar prior basically hair transplant, you're probably not gonna grow basically any new hair. Uh, if you have scarring alopecia, most probably it's not gonna grow more hair. So derma rolling is great, but you definitely need basically you definitely need some hair basically therefore to grow out. Can you make a recommendation for trans guy, born as female, lives as a male? I've been on testosterone for over 8 years and been losing my hair for maybe the last 2 years. Well, then one of the main reasons why you're losing your hair is because you are adding artificial testosterone to your system, and by having that testosterone, you're increasing your DHT, dihydrotestosterone level, and as a result, that's basically causing more hair loss. So you could definitely um, be on the topical happy It solution, and that will help you, because it's going to prevent some of the DHT formation, and that's going to help basically the hair growth. So, I mean, unfortunately, some patients just have to be on testosterone. There's nothing much we could do about that, but the finasteride basically will help you. Any updates on your getting laser caps for sale that could help with hair growth? I believe you previously said you're looking into laser caps. Yes, thanks so much for bringing that up. Yes, we are looking into laser caps. I will shoot an email to our VP of Operations, Eric, and see what the status with that one is. I also want to give everyone an update with respect to our aloe free formula. So our aloe free formula is available now. So if you're using a product and this is making your scalp a little sticky and you want it with that aloe, just email support is help@happyhair.com, and we'll be more, and just say, look, I don't want the aloe in it, and we'll ship you one with the aloe in it. Is spironolactone as effective for one who suffer from alopecia? So spironolactone, oral spironolactone is the number one oral medication pill for hair loss in females. Topical spironolactone basically could be helpful as well, and there are studies that show that is also effective. Now, typically for females below age 50, we do not get finasteride. So the question is, how do you compare spironolactone to finasteride? In my personal opinion, I think the finasteride could be a little more effective than spironolactone. But again, if you're below age 50, there's really not much you could do. Spironolactone is your only choice. What is the ideal hair routine to maximize results? Great question. So basically, to maximize results, it's not just using topical happy end, but also your diet makes a difference as well. Remember, when you put a happy end on your scalp, you're trying to make your hair grow out. You're trying to take those thinner hairs and basically increase the thickness and the caliber of those hairs. So for the hair to grow out, you need vitamins and basically amino acids and proteins. So increasing proteins and amino acids to your diet basically will help quite a bit. So we always recommend basically adding vitamin D to your diet, basically D3, 2,000 IUs a day. If you're a female, add iron to your diet as well. Take a regular multivitamin for everyone. I personally take the Flintstone vitamin, but you could take whatever you want. Also, adding more collagen to your diet, so you could take collagen powder. There's also collagen tinctures that you could use, and also, increasing your protein uptake. So you could eat more avocados, chickens. Those are all helpful, but also more importantly, you could just increase by adding more protein powders. So the one I like is the whey protein concentrate. The two type of whey proteins, concentrate and isolate. Whey protein isolate will increase your testosterone level, so you want to get whey protein concentrate. And sometimes it's tough to find the whey protein concentrate. So the best place to find it is on Amazon. Just type in a whey protein concentrate, and then basically make some collagen with it, make a smoothie, and do it as a meal replacement. And people really say basically that it helps quite a bit. That was an excellent question. And by the way, when you do use Happy Ed, if you use it with a Derma roller or Derma pen, that will be helpful as well. So my recommendation is basically applying the Happy Ed product, and I do like a derma pen, and I'm basically trying to push in the product. And also, if you do the happy twice a day as opposed to once a day, you're gonna see better results. So and also, let's say if you use it for 3 to 6 months and you are seeing some improvement, but you want to get better improvements, we have patients in our clinic that afterwards go on an oral finasteride medication. So basically using the topical finasteride, and after a few months you go on an oral, and by combining the two, we have seen really amazing results. You're literally like trying to re-stimulate those hair follicles, and some patients get a boost. Why that is because when you apply Happy topically, it stays right here, and when you take it internally, it goes from the inside. And the same thing is vice versa. We have a lot of patients that are oral finasteride, and after a while, basically just plateaus. So the answer for that is to add topical Happy. So not only you're taking it orally, but also applying topically, you're attacking the hair follicles from both ends. And as a result, patients basically get much better results. I see people online going to these clinics and getting some kind of injection into their hair to prevent hair loss. What are they doing exactly? Does it work, or is it more options than pseudocides? So yeah, so those injections, we actually do them in our clinic. So they're called PRP, platelet-rich plasma, where we take your blood, we centrifuge it, take the growth factors, and inject it. Based upon clinical studies, it actually it works in about 70% of patients. It really depends on the technique, how it's done, and also how much blood is drawn and how the injection is done. So everyone's different, but actually I'm a PRP specialist, and we do a lot of PRP in our office in Los Angeles. So you're more than welcome to reach out to us. But also we also do PRP with stem cells, and stem cell also will help grow your hair. Unfortunately, none of these are covered under insurance, so they could be a little pricey, but yes, it does help us to grow more hair out. What is derma rolling? What a derma rolling is that it's a derma roller. I'm trying to see if I have one. Yeah, here we go. I actually have one right here, guys. So this is what we call is an automatic derma roller. So so basically what it is that, so you can see there's like a lot of needles right there, and what we do, you put on the scalp, and this goes basically in and out, and what it pushes the product in. So this is a derma pen. This is called derma pen, and there are many brands out there. And there's also a true derma roller. I'm trying to see if I have one here for you guys in my office. I don't have a derma roller in my office, but what a derma roller is the roller version of it. So you literally roll it. They both work very well. I'm more of a fan of a derma pen. I think it's very similar to basically having an electronic toothbrush as opposed to a manual one, and also you're less likely to hurt yourself. So my recommendation is basically put this on the 0.25 millimeter depth, and when you apply Happy It, and just do the derma pen on top of it. But we do have derma rollers basically Happy It as well, so you can also get them. Now my recommendation is basically apply it first once a night, and just do a derma roller once a night. Then there are some patients on the internet that say, oh my god, I'm using a derma pen that's a depth of 1.5. Well, that's gonna hurt, guys. So my recommendation is use the 0.25 milliliter depth, and just do it more frequently. And how often you want to do it. So basically you want to do it once a night, and just do it for about 5 minutes. Do not keep it in the same spot. You want to gently roll around, and sometimes I've been doing it for 2-3 minutes. It's good enough. Now I got derma roller 0.25. Can I press very firmly on the derma roller when I use it? Given that it's not a 1 millimeter 1.5, should it be safe to press very firmly? Well, honestly, you really don't need to be pressing that firmly. It should be the pressure as if you're applying your deodorant. Do not make yourself bleed, everyone. Very gentle. Just apply the derma roller very gently. This is after you apply the Happy It. Good question. So don't use the 1 millimeter. Don't use the 1.5. Let's keep it to 0.25, but just do it gently. I'm using topical Happy It because oral finasteride causes sexual side effects. I stopped using it. I've heard that reducing dosage of oral finasteride may not cause side effects. What do you think? So so if you use oral finasteride and it causes sexual side effects, it is possible that if you lower the dose or the frequency of it, you may not have the side effects. You may. It depends. This is why Happy It was developed. Happy Ed was made for patients who didn't want to use the oral finasteride, or who were using the oral finasteride and got side effects. And with Happy Ed, if you're not having any side effects, that's great. Just keep on using Happy Ed. If you had side effects with oral finasteride previously, I wouldn't necessarily add it on, especially if you're not having side effects with topical Happy Ed. I would just keep using topical Happy Ed for now. Oral minoxidil versus topical minoxidil. Which is more effective and why? Well, obviously, I think the oral is more effective because you're taking orally, but also you're risking more side effects. Side effect includes headaches, heart palpitation, drop in blood pressure, as well as swelling. There are some patients that combine oral and topical together, and that could help you. So my recommendation is basically use the topical happy at first, and then after your body gets used to it, after a month, then you could add the oral minoxidil. The way we add oral minoxidil in our office, the regimen is a quarter of a tablet for the first 2 weeks. Then you go to a half a tablet for the second 2 weeks, and then if you're doing well, then you could go up to like a full tablet, basically once a day, every day. How long should you stop using finasteride before trying to get pregnant? If you, as soon as you're trying to actively get pregnant, you stop the finasteride. So yeah, if you once you guys decide that you want to have a kid, just stop using finasteride. All right, guys. Well, these were great questions. Thank you so much. Again, just a couple updates on Happy Head products. So we did come out with our aloe-free version. So if you want the aloe-free version, please let us know. Just email help@happyhead.com. We are coming out with our multivitamins in the next few months, possibly in June or July. So please stay tuned. We're also basically coming out with our hair thickening shampoos and conditioner, and those should be available, I think, in June. So we're gonna give you an update on our status, basically, of those products. And again, these are all things that you could do basically to better help your hair grow out. Remember, we talked about the diet today. The diet is very important. If you're having any issues with Happy Head, please let us know. We will customize the product just for you. Take out, whatever you need, or reduce the concentration. We want you to be happy. We on your team. We want to do whatever we can to make your hair grow out. We understand hair. This is what we do all day in and out, and so we're totally focused on hair. So if you're using a product and you're having some issues with it, please reach out to us at help at Happy Head, and we will be more than happy to customize the product for you and send it out. Remember, Happy Head is a customizable product that is made on a monthly basis for you and shipped out. Another question people had asked was the alcohol-free formula, just because of some of the irritation. We're still currently working on that, so we should let you know basically right away on that. Last question: do you recommend any oils like black castor oil, rosemary oil? Honestly, here's my opinion. Happy Head was based on clinical data and clinical research, as well as clinical case reports. So everything is backed by medical reports and medical cases. So with a lot of and clinical studies. So with a lot of those castor oils and rosemary oil, the problem is that there's really no clear clinical study on if they're effective or not. Now, yeah, they could work for you, but is it going to work for another 100 people? That's the question. So this is why we don't typically recommend it, basically, for regrowing hair. Now, if you use topical Happy Head and you're getting irritation, sure, you can use rosemary oil. There's nothing wrong with it. But am I going to recommend it basically for hair loss? I'm not going to do that right now, because honestly, there's no clinical studies to show that any of those oils actually work for hair loss. All right, guys. Well, thank you so much for joining us for another AMA with Dr. Ben. I'd like to thank our VP of Operations, Eric. And also like to thank Evelyn, who helps us quite a bit with basically putting everything up and helping run the AMA. Again, I'm Dr. Ben Behnam. If there's any questions, you can feel free to basically reach out to me specifically. Next week, we are not having our AMA, as I am in San Francisco, but we are going to resume the following week. One last question. Best vitamins to take for hair growth. So great question. We are coming out, since you mentioned it, with our really good, amazing multivitamin next few months. That has collagen, biotin, keratin, saw palmetto, like a lot of different things to stimulate basically the hair growth. So we should be there soon. In the meantime, you could take a vitamin D along with iron as well as a regular multivitamin. But again, we are coming out with our hair specific vitamins soon. All right, guys, thank you so much. Have a beautiful day. Bye, everyone.